Hi there. My name is Nicole Albanese. I'm the Residency Program Director for the PGY2 Ambulatory Care Pharmacy at Buffalo Medical Group. Just a little information about the other preceptors in the program. They're all listed here for you. They are all, with the exception of Scott Monty, they are all clinical pharmacists at Buffalo Medical Group. This is the program purpose, which of course every PGY2 program has the same. Just a little bit of history on the accreditation of this program. I was accredited for the full 8-year cycle back in 2017. Prior to having the PGY2, I was the program director for a PGY1 program with like a focus in ambulatory care. And I have been doing that since 2006. So I've been involved in residency training for quite a number of years. Just wanted to give you a quick snapshot of the Buffalo Medical Group website, let you know a little bit about it. They are a multi-specialty physicians group with level 3 patient-centered medical home recognition. We are the clinical pharmacy services is well represented. As you can see, we have our own page that describes what we do and who we are. A little bit about my residency training philosophy. I think this is a really important part of you making your decision on what program to go to. My philosophy is to develop residents who know a lot about how to develop and run an ambulatory care clinic, not necessarily a resident who knows a little bit about a lot of commonly seen ambulatory care diseases. So maybe you've heard of that saying, jack of all trade, master of none. I really want my residents to walk away from this training program as specialists and not generalists. And this may or may not be something that you're looking for. I just like it to be known that that is the way I go about training the residents, as do the other pharmacists who would be preceptors of this program. That's not to say that you're obviously not going to learn about disease states. Of course you are. But I believe that the crux of a PGY2 goes above and beyond disease state management into project management, leadership, people skills, learning how to work with physicians in the most effective and efficient manner. Just a quick overview, as you can see, pretty much everything is longitudinal except for an orientation month in July. And that's for us, that just works the best because this, I'm trying to make you specialists in these different areas, keeping you there so that you can develop relationships throughout the course of the year just makes the most sense. Let's go through each of the learning experiences. So patient care, you would either be precepted by myself or Melissa Appa. There is definitely a focus on the progressive development of the resident as an independent practitioner. I would say probably by the end of quarter one, definitely by the beginning of quarter two, you are seeing patients on your own as an independent practitioner, but you're able to use us as preceptors for sidebar consults and stuff like that. Because we have the 2 residents and because of the way we have to split up duties and, space at our locations and all kinds of contracting and things, projects that we need to get done. One of the residents who I'll say is resident A here would have 40% direct in-person patient care and resident B would have 60. So what do I mean by that? In-person is exactly what it sounds like, that the patient is face-to-face with you physically in the office. The rest of the time, so for resident A, then 60% is spent in direct patient care, but as telemedicine. And then vice versa with resident B. Continuing with patient care, the kinds of things you're going to be doing. We are very heavily focused in diabetes management, and we get this both from the primary care side, but also we work very closely with our 2 endocrinologists, but we're not forgetting who we are as pharmacists. So we're doing med reviews, med recs, care transitions. The residents are involved with our heart failure clinic. There's a pretty large, what I call managed care component, meaning not that you're going to spend time at a managed care facility, but we are so ingrained with the projects and we work very closely with our local partners, that you will have a really good understanding of them and their needs and how AmCare physician groups can work with managed care organizations so that everybody wins, including the patient. The academia learning experience is sort of cruxed in this advanced academic certificate. And so that requires small group teaching, large group teaching, doing a CE, everything that you see here. I would say that this program is pretty heavy in precepting. So because I am faculty at UB, I get 2 APPE students every module. So that's every 6 weeks for us. And I usually pair up one student with one resident and another student with the other resident. And so you will have a good amount of precepting responsibility, and that can really only develop you as a clinician, multitasker, to make yourself much more efficient. Research is precepted by Dr. Scott Monty. He's a faculty member at UB. And I don't really have projects chosen. I'd like for you to be involved in that discussion. Certainly, it would need to be something that the group is interested in. So we try to kind of align those two together as we're choosing a project. Population health is another major component, because that telemed part is part of the public health direct patient care that I was talking about earlier. And we're working on projects that are going to improve HEDIS measures, star ratings, and then the internal quality metrics for Buffalo Medical Group. So these can be anything like CMRs, adherence. We do a lot of statin use in diabetes, statin use in cardiovascular disease. So whatever projects are put into the contracts, which for 2021 are the things that you see here. Additional benefits of the program. We do provide a research training class. So it's a couple of nights early on in the program over the summer when you start to give you a refresher on research so that you can hit the ground running with your project. We do get you involved with a journal club that we have in collaboration with some students at UB. Obviously, you'll have access to the library, and we do provide travel and registration to 2 meetings, one national and one regional. And the national is almost always ASHP. It has been for many years for recruitment purposes. And then regional is likely Eastern states. Been thinking about switching that up to night shift perhaps. And the application information is listed for you here in terms of deadlines and what's needed, and you'll apply through forecasts. I'd like to maybe just end by talking about my past residents and where they've ended up. I had, just in terms of my PGY2 residents, my first resident actually ended up taking a faculty position at the University of Arizona. I had 2 more residents that had taken on clinical AmCare pharmacist positions within larger health hospital systems. One's in Kentucky and one's in Florida now. I did have a resident move on to be an AmCare pharmacist in the VA system. Another AmCare pharmacist at the Joslin Diabetes Center at Upstate. Another started the AmCare services at Primary Care IPA. So that's a local here in Buffalo group of physicians. And so he started the pharmacy program there. And then we did have one who we hired. That was our resident, one of our residents from last year, has stayed on. For me, choosing a resident is really about fit. And so I really encourage you to apply so that I can bring you in and we can meet each other and see how the fit is for you and for me. Well, good luck in your endeavors.